But yeah, let's get started.
All right, good morning, everyone. Thank you so much for joining the MOBAC Self-Care in Times of Uncertainty. This event is brought to you by the MOBAC Reference Committee. Special guests will discuss self-care, barriers that can get in the way, and how to use meditation to reduce stress. To join only by phone or to give this information out to colleagues, please have them call 1-888-788-0099, and then they'll enter the webinar ID of 986-6039, 5838, and then the passcode of 752630. It is essential that you have pen and 8.5 by 11 paper readily available for the activities, and our opening presentations are going to be recorded. For those of you who have not yet had a chance to rename yourself, you just select participants from the menu at the bottom of the Zoom window. A right-hand sidebar appears with a list of names. You'll hover over your mouse over your name to see more, then click more, rename, and then rename yourself as you see fit, and then click OK. Our guests today are Todd Jealous and Caroline Haskell. Here's our schedule. We run from about 9 o'clock to 11 o'clock. Please be sure to stick around for our poll and closing thoughts. There are going to be 2 breakout room sessions. They're each 20 minutes long. This is an opportunity to connect with one another. Please remember to turn on your mic and video, but then be mindful to share this limited open mic time. Raising your actual hand on camera is effective for sharing this space, and then feel free to use the chat function as well. If you're a breakout room lead, please use the raise hand feature to share the results of your breakout session once the group returns to the main room. The raise hand feature can be found by clicking on that participants icon from the Zoom control bar and looking at the bottom of the right-hand sidebar that appears. You'll see a little blue raise hand. And then we'll all return to the main room for a poll and closing remarks at the end of the second breakout room session. I'll now turn it over to David Addison to introduce our event and guests for today. David, over to you.
Can everybody hear me, right?
Yes.
Very good. Good morning, everyone, and welcome to the MOBAC Reference Committee Annual Fall Workshop. My name is David Addison. I'm the chair of the committee this year. And I'm very pleased to see you all here, and I'm looking forward to our program lineup this morning. A little bit about MOBAC. The Monterey Bay Area Cooperative Library System, MOBAC, is a multi-type library consortium of 18 full members, public, academic, and special, and several networking members in Monterey, San Benito, and Santa Cruz counties on the California Central Coast. MOBAC began in 1969 as a public library cooperative, and by 1985 had grown to include academic and special libraries as equal members in the organization. It is now one of 15 cooperative library systems in California and is funded in part by the state through the California Library Services Act and by fees collected from member libraries. In 2009, MOBAC joined the Pacific Library Partnership, a consolidation of several Northern California library systems. I'd like to encourage your participation in our committee or any of the committees if your library system does not currently have a representative for one of the groups. The reference committee is a supportive environment, both professionally and personally. Collaboration is key. We share notes, reference tips and techniques, and brainstorm ideas for improving our reference services, especially during this past year. It's been very helpful for us to check in with each other about what our library is up to. I'd like to thank my fellow committee members, the MOBAC Admin Council, and the Pacific Library Partnership for their support of our workshop and committee goals. It's now time to introduce our distinguished presenters this morning, Todd Jealous and Caroline Haskell. Ann Jealous, a former Monterey family therapist and a founding member of the Monterey chapter of the National Coalition Building Institute, is board chair emerita of the Village Project, a nonprofit Afrocentric counseling center for historically underserved populations on the Monterey Peninsula. Caroline Haskell, LCFW, a certified mindfulness meditation teacher and administrator emerita at CSUMB. Her experience includes clinical counseling services, psychoeducational workshops, and training programs on diversity, equity, and inclusion. Now it's time to turn it over to our presenters. Take it away.
Thank you, David. Good morning, everyone. I'm so glad that Ann and I get to be with you. And Ann and I are sharing this screen, so we will be moving in and out, doing a little square dance, do-si-do. I want to say that much of what Ann and I will be talking about with you, and we're so glad you've all joined us. I'm glad we're doing this together. It comes from our own experience, both as therapists, but also as how we as human beings take care of ourselves. And some of this information, it may be new. Some of this might just be a reminder. Maybe you've heard it before, but our goal and our hope is that you'll be inspired to put some of these ideas into practice, and that you'll sort of, I'm going to call it, there must be a better way. You know, normal life has been disrupted beyond our control in an unprecedented way. And this global pandemic, it not only wreaks havoc, but I believe it brings an opportunity. It can awaken a new vision. It can provide us a chance to sort of reset and reconsider our own lives. Some of you may know that the Chinese character for crisis includes both danger and opportunity. So we're going to provide, Anna and I are going to provide some information about wellness. We're going to have you take a look at your own lives, how you spend your time, present some tools and strategies. Also to give you opportunities in small groups with each other, to help each other out, to share ideas about what's been useful, and also to consider making some changes in your life to support your own well-being, and also to better serve others. Anna and I are big believers that we can only serve others to the extent that we're able to take care of ourselves, and that we need to put ourselves first. We'll talk more about that. So this next slide that I want to show you is just an important concept that we're going to weave in and out of the presentation today. And it's being good to yourself is a simple concept, easier to talk about than to do, that will improve your daily life and help you be good to others, because all of you are working in a library system in certain capacities, and you're doing service to others. So being good to yourself helps you be good to other people. I also have the privilege, I just want to say this, Ann and I do a lot of work together. I consider us a team. Some of you may know we co-authored a book called Combined Destinies, and Ann and I are combined today, so I'm going to turn it over to Ann.
Good morning. It's really a pleasure to be with you. Libraries have been part of my life since I was 4 years old. And by the time I was 6, the librarian said you can take as many books out as you can carry. So I was carrying an armload of books home every week and then returning them to pick up another armload. So I have great respect for you. And I know that you do many services for the community. And certainly our community is in great need at this time. I want to talk just a few moments about why it's sometimes difficult for us to care for ourselves, even if we think it's just because we have so much to do. Sometimes we don't have models for self-care. So one of the things you can think about if you're a woman is, did your mom take care of herself? What do you remember seeing? Maybe she did nothing that you thought was valuable, and you decided to be the opposite from her and do much too much. Or maybe she did too much and you saw her doing too much and thought that was the only way to live as a woman. So that might be part of it, that you might not have had an effective role model for caring for yourself. So that's something to think about. Some of you are old enough so that you perhaps came from moms who did not combine professional work with homemaking. That is, they did not do both jobs, and both jobs can be full-time jobs for sure. So if you're new in your generation for learning how to do that, Or if you are in an age when you're remembering when women were supposed to do everything and do everything well, that also may be problematic for you, maybe something that gets in your way. It's important to think about why we're not taking good care of ourselves and not just lump it into because we have so much that is required of us if we want to make a positive change. The other thing that you might want to look at or just think about is what happened when you were a child, when you were just hanging out, hanging out, reading a book while your mom was working in the house, or just looking, just in your own world, and you got negative feedback about that. Maybe there were messages that came at you that said that it was much better to overwork than it was to underwork. Much better to put all of your energy into taking care of other people rather than to take care of yourself. So it's important to kind of examine your history to see where the messages came from. Certainly they come from the outer world, but they may also have come from your personal experiences growing up. If that's the case, then you might need to talk to that child that you were and let her know or him know that it's really okay for him or her to take a break from caring for other people. You do a great deal of that in your work. I know probably more than ever these days, because there is so very much need. Next slide, please. I'm losing track of the numbers. Is this what number? You know what number? 4. Is this 4? Okay. So look at that. You are going to have PowerPoint slides throughout this workshop, and we're counting on your reading them, so we're not going to read them to you. This one talks about being good enough just the way you are. So that kind of self-acceptance is really very important. It also is true, however, that we are not perfect. We can't be perfect because we're human beings. So being good enough does not mean that we can't make changes if there's something in our lives that we want to change. And there may be something in your life that is related to self-care that you want to change. Today, we're hoping to be able to help you with that. Next slide, please. These are ideas, just suggestions. So you might look at that. My experience is that doing things for other people is major in terms of resisting depression. So if you are on a weekend feeling sad because you've stopped, because you're not having to be busy, and you find yourself not able to take care of yourself because you're just feeling sad, then you might want to think of something very quiet and slow and easy that doesn't take much time to do for someone else. And that can bring you up and out of feeling sad, so that then you begin to feel good about who you are and remember that you need to take care of you. I've heard lots of women talk about dressing up even during this virus time when there's no place to go that they need to dress up for other than to work. So that's an idea that might be useful to you, to just dress up even when you're not going out, to put on clothes that you used to wear when you'd go to parties or nightclubs or wherever it was that you went when you wanted to have a good time, or when you wanted to go to fancy restaurants. Sometimes that's fun. Trying to build something into your life that's fun is really important now, I think. And loving yourself, just really loving yourself. It's also important to remember to breathe. to just breathe, to take deep breaths. Even if you are not feeling anxious or you're not feeling anything that tells you that you need to breathe, sometimes you might be holding your breath. So check in with yourself periodically and remember that breathing is a wonderful way of releasing anything that you're holding on to. It's just a gift that we have, that we can get any moment that we need it. Okay, I think that's it. Would you show us the next slide, please? Sometimes it's very helpful to have a visual image of your life. And, you know, it's important for me to have a visual image of my life, of the time that I spend. In order to do that, it's fun and interesting and helpful to divide your life up into slices and look at how much time you're spending on everything. So today we're going to ask you to make what I call a pie of your own life, and to divide that pie into slices that represent the amount of time you spend in any major category. So this is one example. It's just an example. It includes time for, and it's color coded so that you can see what it represents, so that the first orange slice is the amount of time that this person who did this particular chart spends in bed. Okay, and I think for that person it's about 7 hours. So 7 hours in bed, whether it's sex or sleep, that's bedtime for the person who made this pie. The largest slice on this pie is the professional work time of going to work, driving home from work, and being at work. And then if you look at it, because this person has a family, and family can include pets as well as people, children, parents, siblings, very close friends that you feel are family that you take care of. And the next slide, slide on this person's pie goes to taking care of the family, with the exception of the meals. Meals means preparation of the meals, shopping for the food, preparing the meals for yourself as well as for other people that you prepare meals for. So if you're making lunches for kids before you go to your workplace, include that. Everything connected with food. And then the next size of the slice is, for this person, is mental health care, stress reduction. He or she spends quite a bit of time focusing on taking care of friendships, doing everything that feeds good mental health, meditating, reading books that are not stressful, taking walks, running, doing exercise, so forth, will also fit into personal body care. Although in this pie, the personal body care is really relegated to bathing, shaving, taking care of hair, really just getting dressed, that amount of time. And then because this person lives in a home and has a garden, he or she devotes that slice to that. So any of the pieces that provide satisfaction are left alone, but any of the pieces that seem not to be big enough have to be addressed. What we're going to ask you to do today is to make your personal pie. Is there a way I can get to the notes?
I'm not sure. Ask there, even ask there.
And I don't I don't see them. Okay. So we're going to ask you to break out into small groups and to take the paper that we've asked you to bring, the 8x11 paper and the pen, and draw a circle. Now, obviously we did not ask you to bring paints or crayons, so you won't be able to color it. And this is going to be rough. So, but label, just put the name, the words in your pie slices so that you know what it is, and just do it approximately. Think about how much time you spend going to your job, coming home from your job and being there, and how much time you spend in bed, how much time you spend taking care of your family, how much time you spend taking care of your own mental health and your own stress level, reducing your stress level, how much time you spend taking care of your house, your garden, and preparing meals and shopping for food. And divide your pie into slices that represent those times. And then we're going to ask you to talk a little bit about that, if there's still time in the group when you've finished, to share and to look at your pie and think about how you feel about what you see. Because the experiences that we have also, we can think about, but we also can feel about. And it's important to be able to notice what's happening in your body when you look at something that represents your life. You will get a lot of information from your body about how you feel about that and whether or not there's something that you want to change, or whether you like it the way it is. And then we're going to ask you to come back together after a 20-minute break to do that work and let us know what your experience has been. Okay. So is that okay?
Yes, tell Sarah you're ready for
Right, so we're going to be moving everyone to breakout rooms momentarily. You'll see a little pop-up that asks you if you'd like to join the breakout room. So we encourage you to do that. There'll be just a little bit of a lag. You'll move over to the breakout room, and then we'll issue some instructions once you're in there. And then, as was mentioned, there will be a breakout room lead that will come back and share your experience. So it'll take just a moment to get everyone moved over. So when you see that, you may have to move the Zoom window around a little bit to be able to access that breakout room invitation. But we are going to move into breakout rooms now.